Okay, we're going to switch up our format here a little bit for our next session. We're going to have 4 panel speakers talking today about culturally appropriate food options. And if the panel members will join me up here on the stage, I'll introduce them as they get situated. Okay, so starting from your right, we've got Janet Jackson-Charles. Janet's the Director of the Office of Nutrition Services at the Washington State Department of Health. She oversees the Washington State WIC program and the Farmers Market Nutrition Program, as well as a portion of the state's SNAP-Ed Nutrition Education Program. She also currently serves as the chair of the Board of Directors of the National WIC Association. And next we have Dr. Delores James. Dr. James is an associate professor at the University of Florida. She is both a registered dietitian and a health educator. She conducts research in the areas of obesity and weight management, nutrition education technology, breastfeeding, health disparities, health literacy, and I'm very interested to know about social media engagement and health. Dr. James was the lead author on 2 position papers from the Academy of Nutrition and Dietetics on the promotion and support of breastfeeding. And our third panelist is Christina Mcgeough. She's the Clinical Director of Diabetes, Nutrition, and Wellness at the Institute for Family Health, which is a network of federally qualified health centers across New York City and the Mid-Hudson region of New York State. Over the past 10 years, her work has focused on developing culturally appropriate diabetes and wellness programs to be implemented in community, clinical, and business settings. For example, while working in Harlem and Washington Heights, she worked with Latino women who had gestational diabetes and developed nutrition materials and programs for parents of toddlers. And finally, we have Dr. Joseph Sharkey. He's a professor in the Department of Health Promotion and Community Health Sciences at the Texas A&M School of Public Health. He's also the founding director of the Program for Research and Outreach Engagement on Nutrition and Health Disparities Solutions. Dr. Sharkey's work examines the causes and consequences of food security among children, adults, and seniors in functionally rural and underserved areas. So the way this is going to work is each panel member will offer their insights on the issues that the committee should consider in thinking about culturally appropriate foods for the food options in WIC. Each presentation will last around 10 minutes, and after that, we'll hopefully have an open discussion with the committee. So, Ms. Jackson-Charles, you're ready to begin?
Thank you. Let me just say how appreciative and humbled I am to be here. I am hoping to help bring the picture of the experience in the WIC clinic to you. I'm certainly not an academic. I'm just an old social worker who came to public health through a social justice perspective, and so particularly this piece of the conversation is important to me, but assuring that our families have access to healthy foods and that they have opportunities to learn about healthy ways to feed our family is really important to me, and my other WIC colleagues will help add to that as well. I think that for me, well, to give you some context for the state of Washington, we are a diverse state, but our non-white ethnic populations tend to be quite small. And for example, we have about 10% of Asian women represent about 10% of our general population, and we have a fewer participation in the WIC program. It's about 5% in the WIC program. On the other hand, the Hispanic population in the state of Washington is about 22% of adult women, and in the WIC population it tends to be over 30%. So there's a little bit of variability, but in general there's a fairly similar population in the WIC program as there is in the state. So those folks, the Asian participants and the Hispanic participants represent, continents of people with very wide differences in their eating practices. And then we also have a pretty significant group of formerly Soviet citizens and now a pretty good representation of African immigrants. So that's a pretty broad range of food customs. We regularly translate our materials into 13 languages. So we're working with a lot of different people. So the challenge then of providing culturally appropriate practices really is an element of our participant-centered services, where we're attempting to work with clients from their perspective to really understand and respect their experience and background, and to interact with them in a way that feels respectful and inclusive. I really appreciated Dr. Studi's reference to an adaptable framework for meeting nutrition needs and cultural preferences. I think the word adaptable is really what's critical as we move forward to make further improvements to the food package. And clearly those changes that were made in 2009 were significant and welcome and about time. So there are really good additions that happened there, and it's a great step for FNS to take that measure. We do have some opportunities to make further changes. Some of them are more structural and really probably more FNS responsibility than the responsibility of the committee, but I was really excited to hear about the research that Melissa was talking about in terms of what's happening at FNS to look at listening to our participants and really hearing from the people that we're trying to serve about what's missing for them. And I think that the FNS could support us in trying to serve special populations like those who observe halal or kosher foods. It's a great challenge for us to keep track of which foods are and are not acceptable for that population. We are working on that. We are one of 90 WIC states, and so I'm assuming that many WIC states, many of the 90 are doing that work as well, to have some way for both the food industry to accurately label their foods so that we're sure that we're offering appropriate foods for those who observe halal and kosher. And also for us to be able to define those and find those in stores would be very helpful, rather than all 90 of us trying to figure that out. And that includes some of the baby food products that at this point are not available. As you may know, the halal baby food meats are not available. And some formulas and juices have some enzymes in there that are not appropriate, that are traces and are not included in the labeling. And so we are not certain that we're always giving an opportunity for these families to have the food that they want. And in addition, of course, commercially prepared baby food is not common in many cultures, and so I was excited to hear Dr. Johnson talking about the lumpy foods at 6 months. We would like for people to have an easy way to use those fresh fruits and vegetables and instead of the jarred foods for those for whom that's not a custom, or for those who, I live in the land of granola moms who want to make all their own food and juice too. So to be able to accommodate some of those things that are kind of from the adult table and make it more of a family meal rather than that separate baby food over here, I think is supportive of a number of different cultural issues. But I think, again, thinking a little bit more specifically around cultures, the addition of the whole grains addition is really important, and there's some others that are not, that are more common in certain cultures, like sorghum and millet and freekeh and teff. Now, I don't even know what those are, but that's the point. It's not about me. It's about people who that is familiar to and who want to use those foods. So, and then the same thing about proteins. If we could expand the protein options to include seeds and nuts and other soy products, there would be a population that would be better served by some of those options. And I mentioned fruit, but fruit juices, to be able to make juices or to have fruits instead of juices for those who are not accustomed to having juices would be a healthy option for a lot of populations. Checking the clock. The issue around lactose intolerance for a number of populations, West African, Arab, Jewish, Greek, Italian, many Asian and Native Americans. So it's a little bit confusing for trying to provide non-lactose products. We offer lactose-free, but because of its expense, we wait for clients to ask for it. That's a cost containment measure that we sort of use, but it also means that if we have a client who's not comfortable saying, I don't want that, I need something else, we've missed an opportunity to provide them something that they want. So the cost issue is important at that point. And the cost containment is a barrier in certain areas of foods, and I think about our tribal programs. Washington doesn't have intertribal organizations that are separately funded by USDA, but we have 14 tribal programs, and many of those tribes are working toward having more traditional foods. And the traditional foods, as I understand them, and I have limited knowledge of that, there's a lot of seasonality around those foods and very narrow, and so cost again is an issue, and even knowing how we can best make that available to our tribal participants. Not having enough information about that. Would love to have some attention paid to that group. I think finally I'd say that breakfast cereals are a challenge in many ways. I'll talk about that a little later in the vendor part, but we have a wide variety of breakfast cereals available, and that's another food that's not common in many cultures. And more traditionally might have soups or fish or rice or ancient grains as breakfast. And we've recently learned that millennials don't want to eat a bowl of cereal because they don't want to wash the bowl. So we have another group. There was actually research, I didn't make that up. So, how we provide, rely on that to be our a whole grain source. And again, many of our cereals have a lot of bran in them, and that's not a flavor that's appropriate for some cultures. So a lot of emphasis on cereals, and maybe we need to think about some other options on that. So just to wrap it up, we know that there's evidence that immigrant health is impacted by coming to our country, and not in a good way. And so we want to increase the variety of foods that we can offer and the flexibility, our ability to meet more appropriately the cultural needs and better support the future health of different special populations. I think a secondary benefit of that, because WIC staff want to do their best with their clients, there might be some motivation, better incentive for staff to learn more about some of these other cultures. And of course, if we could more easily recruit, train, and hire staff from those populations, the better we could serve those as well. 30 seconds. Thank you.
I have slides.